So I'm Dr. Nate Hayes with Rockford Chiropractic, and a lot of patients ask me what motivated me and inspired me to be a chiropractor, and a lot of times I'll tell them that chiropractic found me because when I was a kid I always used to go with my dad when he would have his chiropractic adjustment visits with Dr. Jim Holsebus, and he worked as a sheet metal laborer. Now he's retired, but I would always see the results that my father would get, and as I got a little bit older I started playing a little bit more sports, and Dr. Jim talked to my father about how chiropractic could help me be a better athlete and stay that much healthier as a growing child, and started getting me adjusted as well. Even at a young age I was able to notice anytime I would get adjusted I felt so much more clear when I was playing. The biggest thing too was that I felt I could breathe a lot easier because neurologically I was getting more oxygen to all my cells. I never had any of the blurred vision. I could run further, I could run faster, I got winded less often. That's when it really started to click with me that chiropractic was simple and it made sense. So I started to pay that much more attention to what the chiropractor, what Dr. Jim Holsebus or Dr. Scott Steer used to talk to my father and I about during our appointments. And when I was in high school at Hononegah here in town, we had to do a project on a career that we might be interested in. And my dad said, well, what about chiropractic? Do you think you'd like doing a project on that? So I sat down with Dr. Jim and Dr. Scott, and I was able to shadow them in clinic for a full day to see what really does a chiropractor do. I got to see examinations be done and explain to me why we do the exams. They took x-rays. I was able to see them take full spine x-rays. They showed me different patients x-rays of what normal should look like and how the spine can misalign and how it can affect the body. And then the more I learned, the more I found out chiropractic really made sense to me because I was always a healthy, active individual. I never was one to jump to pills or take medications for little things like this. I never was a fan of it when I was younger, and I'm still not to these days. But I always wanted to help people. I always wanted to be a doctor of some sort, but I never wanted to prescribe people medication. I never wanted to go into surgery where one wrong slice with a scalpel and I could paralyze somebody. I never wanted to have the weight of losing a patient on the table, but I really wanted to help people. So that's when chiropractic really started to speak to me. So I sat down with Dr. Jim, and he said if I really was interested in chiropractic, there was only one school that I should look at, and that was his alma mater, and all of the Holsebus family here in this office at Rockford Chiropractic that told me Palmer College of Chiropractic in Davenport was where I needed to go, do a campus tour to check out what it really is and see what it would look like to get me enrolled if that's the direction I wanted to choose. And so we set up a day and went down to the Quad Cities, and I really fell in love with the school and all they had to offer with all of the history and all of the training, all of the technique. And here we are all these years later after I graduated in 2011, and I'll continue in this profession. Probably won't even retire, probably will just eventually slowly cut down on the number of days in clinic. But I love being in the trenches every single day, helping people get them quality results without having to rely on drugs and surgeries, because that's what really motivates me. And in fact, some of my favorite cases are the patients who already have had either a neck surgery fusion or a back fusion surgery, or have had discs surgically removed, different parts of their spine that have been cut on. They don't even think they can be adjusted in those areas because different doctors have told them. What I found clinically, when we take proper x-rays and do full examinations on their spine, a lot of the symptoms that they still suffer from post-operatively, we can still get great results whether they've had surgery in that area or not. And just being able to see their faces once they're able to reduce the numbness and tingling in their hands, get sensations back into areas that they haven't had it before, and just reduce the pain levels that they've been living with for years and years. It's such a great feeling to see how they smile so much more in life because they're able to connect and do more at work, do more with their family, and be more present. And that really, at the end of the day, is what motivates me to continue working in this great profession of chiropractic. So thanks for tuning in, guys.